Welcome back. Before we begin, let's briefly review the previous lesson. We discussed the DSM-5 as a key tool used by mental health professionals to diagnose and classify mental disorders. We also highlighted its importance in ensuring accurate diagnosis, proper treatment, and consistency in mental health care. In this lesson, we will discuss the historical perspectives and current trends in psychiatric nursing. And, by the end of this lesson, you should be able to 1. Describe the historical development of psychiatric nursing. 2. Identify key contributors and major shifts in psychiatric care. 3. Explain the transition from institutional to community-based care. 4. Discuss current trends shaping modern psychiatric nursing practice. Let's look at the historical perspectives and current trends in psychiatric nursing. Psychiatric nursing evolved from basic patient care in large asylums to Hildegard Peplaw's therapeutic communication model and advanced practice roles like the psychiatric mental health nurse practitioner. The key historical shifts include improved conditions from the 1800s reformers like Dix and Nightingale, the move to community-based care during deinstitutionalization in the 1960s, and the subsequent development of specialty education and expanded practice roles. The next area is the current trend, and the current trends focuses on comprehensive care, including pharmacology and physical assessment. Evidence-based practice. Expanded roles for advanced practice nurses, like the psychiatric mental health nurse practitioner. Political advocacy for mental health services. And integrated care models. Diving into the historical perspectives. First, the early custodial care. The history of psychiatric nursing began with the care of individuals with mental illness in custodial asylums, often characterized by poor conditions and overcrowding. Besides that, there is reformer influence. Reformers like Dorothea Dix and Linda Richards in the 19th century advocated for better, humane care for the mentally ill and the establishment of training standards for nurses. Furthermore, we also have therapeutic revolution. In the mid-20th century, Hildegard Peplaw's work on therapeutic communication and the nurse-patient relationship transformed psychiatric nursing, launching an era of skilled interpersonal care. Similarly, there is the community mental health era. Federal legislation, such as the Community Mental Health Act of 1963, shifted focus from institutions to community-based care, impacting nursing practice and education. Exploring the current trends, we have A. Integrated care. Psychiatric nursing curricula now often incorporate physical assessment, pathophysiology, and pharmacology, reflecting a holistic approach to mental and physical health. Next, B. Advanced practice roles. The model is increasingly shifting to a primary mental health care model, with the development of advanced practice nurse practitioners, NPS. Also, we have C. Evidence-based practice. Current trends focus on building upon evidence-based research and practice, with organizations like the American Nurses Association, ANA, providing standards for the specialty. And D. Holistic philosophy. There is an emphasis on providing comprehensive care that is grounded in the holistic philosophy of nursing, viewing mental health as a broader state of well-being beyond just the absence of illness. And lastly, E. Global mental health. With a significant portion of the global population experiencing mental disorders, psychiatric nursing is increasingly focused on addressing these widespread mental health needs. Bringing all together, we will conclude by stating that 1. Psychiatric nursing has evolved from custodial care in asylums to a specialized professional field. Secondly, reformers like Dorothea Dix and Florence Nightingale improved conditions and care standards. Next, Hildegard Peplau introduced therapeutic communication, transforming nurse-patient relationships. And lastly, current trends include integrated care, advanced practice roles, evidence-based practice, holistic philosophy, and global mental health. Thanks for watching. See you in our next video.